رسوله محمد وعلى آله وصحبه أجمعين وسلم تسليما كثيرا كثيرا أما بعد سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي أما بعد. So you have heard me talk so many times. I want to give the opportunity to Dr. Uthman Ali, inshallah, to do most of the talking today. In the education committee meetings, alhamdulillah, we have a variety of people who attend our committee meetings. And we have physicians who attend our meetings, alhamdulillah, every other week. And in those meetings, I'm fine. In those meetings, we have discussed about, alhamdulillah, we discussed about religious programs that take place at the masjid, but at the same time, we felt that there was a need to conduct programs at the masjid that were related to the subject of body and mind. And so we decided to come up with this series. If you remember, one time before, we did kick off a series, but for some reason, it never continued. We, inshallah, at this time in the education committee, we are determined to make sure that we start this series, which is called the MED series, Medical Educational Discussion Series, inshallah. Dr. Uthman Ali will be talking about what will be discussed in this upcoming series. This series will take place once a month on a Friday night, inshallah. And whatever questions you may have, Dr. Uthman Ali, inshallah, will try to answer those questions. And if any of you in the community feel like that you can contribute to this program, we don't want to shut the door to anyone else. We understand that there is a great amount of talent in the community. There are a lot of other people who can contribute to this series. I would request you to please bring it to the education committee, inshallah, because this is the process that we have. Any other programs that you want to do at the masjid, you bring it to the educational program, the educational committee, inshallah. Having said that, I'll give it to Brother Uthman Ali. Before that, one more thing I want to mention is that when it came to mind, the reason we selected this topic is because even Rasulullah sallallahu alaihi wasallam, he talked about this, he lived this topic. There are a lot of people who have these kind of issues, whether it's health related, whether it's psychologically related. There are people who say time after time that I feel anxiety in my life, I feel depression in my life. There's so many physical challenges that I go through. I need some help. And here at East Plano Islamic Center, we don't want to only provide Islamic programs, but we want to provide programs that cover a wide range of topics. So having said that, inshallah, I'll give it to Dr. Uthman Ali. He will talk about this as an introduction, and then inshallah, we will be starting this series from next month, inshallah. Jazakumullah khair.
Assalamu alaikum. Okay, thanks for coming here. And the Imam essentially said it all. So I won't repeat everything, but I will, say, there's so much going on in the world, so many stressful things. It affects us. And so, why should we be paying attention to ourselves? Why should we be focusing in on ourselves when there's so many other people suffering? Why should we be, addressing our personal needs? Well, the reason is that we can't be effective in doing things if we're not first taking care of ourselves. So, there are several health providers in the community who are going to be contributing to this series, inshallah. And we still are looking for more providers. So if you are interested and have some things to talk about, please approach us. So, now, okay. So, first, just before we begin, please definitely clarify any perspectives pertaining to Islam with the Imam. And this is for educational purposes. We're not diagnosing anything. We're not doing any treatment. And also, afterward, what we're going to be doing is a goal-setting session. So in that, if people do bring up topics, I ask you to be compassionate with each other and confidential if people do bring up questions about themselves. So the objectives are, one, to appreciate the Islamic obligation to take care of one's health. Second, not to see health as just a mind thing or a body thing, just that they are really, one affects the other. And third, to actually make a plan with specific strategies to actually practice over the course of the year. Because you already know, eat right and exercise, you already know all that stuff, but we want to actually see people engaging in these things. And oftentimes we think of health topics unrelated to Islam, or it's just another thing you do. But really, we want you to see taking care of yourself as part of your Islamic obligation. There are several hadith that suggest this, and you all might know of some more, but there's this one hadith. I'm not going to read the whole thing, but essentially, when there is an injured person, the Prophet ﷺ looked at him or looked at the injured person and asked, which one of you is a better doctor? And the Prophet was asked, is there any good medicine? And the Prophet replied that the one who sent down the disease also sent down the remedy. And obviously I'm paraphrasing there. So that there was a need or recognition that healthcare is important. And the Prophet ﷺ said, two bounties regarding which many people cheat themselves are health and free time. And another thing is any action without the remembrance of God is either a diversion or heedlessness, excepting 4 acts: walking from target to target during archery practice, training a horse, playing with one's family, and learning to swim. So we know, you all probably know better than me how physically fit the Prophet was. So in essence, Islam encompasses our health. We have a strong legacy of Muslim physicians and scholars and scientists developing systems of care and advancing medicine. And that we recognize that our existence, our physical bodies, are not our own. We don't own them, we're borrowing them. So we want to take good care of them as best as we can. So why this mind-body approach? Where does that come from? So there was a study that was done, and they found that people with severe mental illness actually were dying 25 years before the general population. So that's a significant decline. So people who were not taking care of their mental health would be dying earlier. So there are clinics where they put the psychiatrists and mental health professionals within the healthcare setting, and they wanted to know how does that affect the healthcare. So what they found was that in terms of diabetes, glucose, the green means it got better, the cholesterol got better, blood pressure got better. These yellow things said they didn't really change. The only thing that actually got worse in these clinics was smoking. So I don't know what to make of that. I guess people were nervous about the psychiatrist being in the office and they started smoking more. I think it's more related to people who are actually talking about it. So primary care providers aren't really used to, they don't have time really. So people were paying attention to these areas more. When you go to primary care clinics, if you ask your primary care doctor, a quarter of the people who come in have mental health issues, and only half of those people are treated. When you look at the contributors for mortality and morbidity, meaning early death and disease, it's not genetic factors, but behavioral health factors that play a bigger role. So what can we do about it? So yeah, this is where I say eat right and exercise, and you all know that, so you can go, right? So let's look at it a little bit more closely. What can you do in times of stress? What can you make sure that you're doing the basics? These are all the basics that I've kind of pulled together from various areas, and you all know some of these, but I'm going to go through each one at a time. So, and I save the last one, the mindfulness and cognitive habits, towards the end. So movement and breath. So essentially, there's strong evidence that exercise lowers the risk of early death, heart disease, stroke, high blood pressure, cholesterol, diabetes, cancers, and it reduces depression and improves memory. So what do? 30 minutes, 5 times per week of moderate intensity exercise. In order to get that done, find a partner, friends, make it a fun activity, make it part of your routine. And you can prevent injuries by stretching beforehand. Even moderate intensity walking counts. I don't have to tell you how to breathe. We all breathe, but sometimes we can be so not attuned to our own bodies that our breathing habits become more of a stress to us. So every once in a while, you want to pay attention to how are you breathing. There are ways of immediately reducing stress by focusing in on your breathing, establishing a good posture, slow, deep breaths in through the nose, first expanding the chest, holding it for a second, then out through the mouth. This is something can have an immediate impact on anxiety, but if you have generalized anxiety disorder, more serious conditions where the anxiety is not reducing, then breathing is not going to usually help. Next, and I'm going to talk about nutrition and supplements very briefly. So you want to consider your food like a medicine. So anything that you're putting into your body, anything that you're eating, would it be something that would be prescribed to you? If it was prescribed to you, would you be eating it? Because that's essentially what food is. When you think about when you're eating as well, what are the habits of eating? And you all know the sunnah of eating. There are several stages. The visual stage, there's the chewing stage. Do we think about how you eat? Do you eat rapidly? Do you slow down? Do you appreciate what you're eating? And do you stop before you're actually full? Then that is also a sunnah. And if you wait till you're full, it's too late, because that signal, it takes some time to get up to the brain to tell you you're full. So you have to actually stop before you're full. There is actually growing evidence that you can reduce your belly fat and insulin resistance with intermittent fasting, 1 to 3 days a week. And that is also a sunnah. Some people eat not because they're hungry, but because they're thirsty. They haven't been keeping up with their hydration. And so if you're hungry, go for some water. Keep some water with you throughout the day. Not when you're eating, but actually between meals. And very importantly, you want to read the nutrition labels. Reduce your sugars to less than 10% of calories. Increase, jazakallah khair. I obviously haven't been taking that good care of myself, so don't do as I do. And do you have 30 grams of fiber per day? And you also want to reduce your saturated fats to less than 10%. There are some switches you can do, very, very simple. Take wheat bread versus white bread, lower your fat, lower fat milk, fish versus beef, nuts over chips. That doesn't mean put nuts over chips and eat them. I mean, choose nuts over chips. Olive oil is better than butter. Supplements, I can't go through them all. That's a whole another topic and lecture, and there are people actually in our community that are experts in that area, and experts in herbal medicine and prophetic medicine. But I will mention just a few things. If you do take turmeric, I looked it up, and there doesn't seem to be very many. It's pretty safe. So, and the substance in it actually may reduce the number of heart attacks that bypass patients have after surgery. Control knee pain, osteoarthritis, just as well as ibuprofen did, and it can reduce skin irritation caused by radiation treatments and breast cancer. I mentioned this aromatherapy because there's not very many ways that we have to actually get to our inner brain, except using aromatherapy. Using pleasant scents can actually create a different state of mind. It has a direct connection to the limbic system or emotional system. And when you do look at actual supplements, make sure what you do is you're paying attention to the quality of it, how much is actually in it, and looking at the safety of it. Talk to your doctor about whether it interacts with other medications that you're taking or conditions that you have, and then look at, well, how effective is it? Because it might just be there's not very many risks or harms. The only thing that it's really harming is your pocketbook, because it may not be helping you unless it's in the right doses. And you want to look at just basic medical causes. So if you're experiencing depression and you don't know what your vitamin D level is or your thyroid hormone is, you want to see your doctor about that. A lot of people kind of see omega-3 fatty acids as a panacea, and in actuality, there are lots of studies that are showing very positive results of omega-3 fatty acids in terms of heart disease and depression and anxiety. We're actually using it as an augmentation strategy for treatment of depression now. It lowers inflammatory markers, but say if you're on blood thinners, you want to be careful about taking omega-3 fatty acids. So why do I say read the nutrition labels? You'll see the ingredients. You try to read the ingredients, and they'll throw you off. They'll combine things together, separate them out. It's a lot of tricks in ingredients. For example, they'll divide up sugar into like 17 different kinds of sugar, or they'll say it's skim milk, but then later on it'll say it's skim milk plus milk fat. So okay, isn't that whole milk? And hiding things like hydrogenated vegetables by using and or. Well, it's true, especially if it's just hydrogenated vegetable oil. That's not good. So you want to read the nutrition facts. What I do is start off with the sugars here, and I look at the grams per serving. So say you have a cookie, and it has 5 grams of sugar, and the cookie is one serving size is 15 grams. Well, imagine that cookie, a third of it, being just pure sugar. That's how you can see, okay, what am I eating? Is this really something I want to consume? You want to definitely keep the trans fats 0. The saturated fats you want to keep low as well, unless they're some of the good types of saturated fats like that come from nuts. And yeah, I mean, you all know how to read nutrition labels, but so obviously most sugars are not healthy. Think about, do you get enough fiber per day? Because fiber can be very, very helpful. So next thing, sleep and structure. So insomnia is one of the major complaints that goes across medical specialties. And the best treatment for insomnia, does anyone know what medication is, or what treatment is the best for insomnia, chronic insomnia? It's not Ambien. It's not Xanax. It's actually behavioral treatments. It's actually sleep hygiene. It's called sleep hygiene. So, and if you snore loudly, I guess people think of it as funny, but it can be a serious medical condition. If you snore loudly and you're kind of waking up or not waking up, and your spouse says that you're it seems like you're gagging, you want to look at these risk factors for obstructive sleep apnea. If you have obstructive sleep apnea, it means that the back of your tongue is stopping you from breathing in the middle of the night, and your brain is waking you up so that you can start breathing again. So the risk factors to think about is snoring. Are you tired during the day? Have you been observed to stop breathing while sleeping? If your blood pressure is high, your body mass index is if it's over 35, age over 50, neck size over 16, or male gender. Another thing to recognize is sleep deprivation is cumulative. So if you're depriving yourself of sleep and you don't catch up during the day or at some other time, it actually adds up. So, and what you do during the day really trains yourself for sleep. How are we doing? And at this time, if you're working yourself really hard during the day and you're not taking time to take breaks, your attention level, things drop off. But if you have any of these symptoms of sleep apnea, you really want to talk to your doctor about that. Okay. Another way of handling stress and resiliency is really cultivating positive relationships. If you know of family or friends in the community that have not been coming to the masjid or who have not been, interacting that much, you want to reach out to them, because then sometimes when you need them, they'll be reaching out to you. And in terms of developing your character, you want to look at what you can do for yourself before you try to change other people. It's hard enough to change ourselves. So if you're having a difficult relationship with someone else, sometimes we don't get along with our spouses. It happens. Think about, rather than pointing the finger, just say, okay, what can I do to change myself, and lead by example. There are healthy coping mechanisms like humor, altruism, and sublimation, and I'll talk about those later. But essentially, altruism is doing positive things for others when you're under stress. So that actually is a very healthy coping mechanism. Sublimation is taking that stress and putting it towards something that is going to be useful for you. So now we come to the big finale, the mindfulness and cognitive habits. And I'll just take a breather here. So what is mindfulness? So mindfulness-based stress reduction has been shown to be helpful in reducing stress and anxiety. It is essentially the practice of paying attention to the moment that you're in, not thinking about the past, not thinking about the future, but paying attention to where you're at right now. Starting with even just the sensations that you have, the sensations in the chair, your breathing, paying attention to the sounds that you're around. If you're sitting in a park, that's a great time to practice that. Sometimes you utilize one word or repetitive words that help you focus, and we do some of that already. You actually, when you're in that state of mind, your brain waves are not the same as when you're sleeping. They're not the same as when you're alert. So there's a different state of mind that you get in. Also, there's been research that shows practicing gratitude actually helps your physical and your mental health. And we do that, obviously, all the time. We're thankful. And so when you're in times of stress, practice that. So cognitive habits are things that you do automatically, but it's not always reasonable. So we live in a state of mind where our behaviors are influenced by our mood states and what we think. So how we feel and how we think is what we do. So you can affect your mood, you can affect your anxiety, you can affect your depression, you can affect your anger by addressing your cognitive state or your thoughts. Some of those thoughts are actually out of your awareness, so you don't know them. And you won't get to know them unless you actually practice trying to pay attention to them. And it's not like I can teach you this completely right now, but it's something to think about. This is the contrast between if your mind is full or if you're mindful. If you're paying attention to the moment, what's around you, rather than just all these other things that are stressing you. So practicing that often. This is the picture of the brain that we all often see, but we don't realize that there's a lot behind the brain. This picture is just the cortex. That's the cognitive brain. That's the rational brain. This shows a lot of other structures inside, the so-called primitive structures, the ones that are more associated with the irrational or emotional brain. So generally, the rational brain is managed by the cortex up here, and the emotional brain is managed by many of these structures. Immediate gratification, typically selfish. That's what the irrational brain is. And we know that we all have the capacity for that inside. And our struggle is to constantly be doing good things so that we can be on top of our irrational brain. And in times of stress, which part of your brain wins out in times of stress? It's the irrational brain, pushes through. So it's important to practice before you're actually in the time of stress. So some of this you're aware of, some of it you're not aware of. You're doing things sometimes based on your irrational brain that you're not even aware of. So the more you practice thinking about yourself and reflecting, the more likely you are to become aware of that. So there's a treatment called cognitive behavioral therapy, and that's where you examine your thoughts and you figure out which ones are influenced by your emotions and how your emotions are driving your behaviors. And this is a very well-established practice that actually works. It's a 12-week course of 1 hour a week where you go through this therapy, and it's not thinking about the past and all that stuff. It's just kind of going forward. So here's some examples of how our thoughts are muddled up by our emotions. So sometimes we do all or nothing thinking. We go to extremes, so that emotional brain doesn't know any gray area. It just says good, bad. So it starts to think people are all good or all bad. And if someone does something to you, then okay, that person is a bad person. Magnification, thinking things are more important or more significant than they are. Okay, so you made a mistake. But the brain, that irrational brain, thinks, oh, you made a mistake. This is horrible. This is terrible. That builds up anxiety, builds up fear unnecessarily. Mental filter, dwelling on the negatives and discounting the positives. Our irrational brain tends to do that. Fortune telling or mind reading, thinking that negative things will happen when there's just as likely a chance that positive things would happen, or assuming things about other people that they're thinking something about you. So you've all seen this, right? Someone's in the car, you're driving, and they're driving by, and they're texting, and they come into your lane. First, you can be thinking, why do they have such an old phone? And then you might be thinking, you might start getting angry. You might start saying, why do they cut me off? They did it for a reason. Usually a more healthy way of managing it is through humor. Another, we talked about altruism. So that happens to someone, they start thinking, you know what? I need to go talk to our teens about distracted teen driving. I'm going to do something positive about this. So this is just an example. Or putting that energy towards where you're going to be going and doing a good job. Less healthy ways are just acting out, like going back and cutting them off. Displacement, going home and, whatever happened, just putting it onto someone who is, your target. And that happens automatically sometimes. We're stressed, boss says something, go home and, easy target, someone upsets you, and then you yell at them. And, it can be anyone. It can be either spouse. And projection. These are just, some of the things. So projection is when your thoughts and feelings, you start attributing them to other people. It's a little bit more complicated, but you start focusing on how, other people are bad drivers when you might not be a very good driver either. You might be driving not defensively. You might actually have been texting the other day while you're driving. And then there's the denial. That's where you have a complete lack of awareness of your own issues that are adding to the mixture. So by now, essentially, we've talked a bit about all these things, and there are some ways that you can disentangle your emotional brain from your cognitive brain. There's some resources that I have. I'm going to, inshallah, put them on the website so you can download and look at them. There's actually, maybe I might have the file. I can open up and show you some other strategies. Does anyone want to see some other cognitive distortions and things like that right now? Or I'll go through it next. So if you all want to take a I think I might have a few more slides. Yeah, so this is basically part 2. If you want to stay, you're welcome to stay. If you're not tired, then that's fine. I have some papers. Let me hand them out, and with pencils as well. So yeah, inshallah, if you could. And you don't have to do this now if you don't want to. Just take a look at it, go home, think about it, or if you want to I'll go through some example ones, and then if you have any questions, I can answer the questions. So a lot of people are already in business fields, so you probably know about what SMART goals are: specific, measurable, either action-oriented or achievable, or assignable, relevant, and then time-based. So we want to create SMART goals, and so throughout this series, no one's going to be asking you if you're achieving your goals or not, but maybe every time we have a med talk, medical education discussion talk, you can say, okay, I remember making a goal. Did I start doing that? Or my goal is to achieve these things before the next time that we have the next med talk. So it's nothing, that dramatic, but it's basically a simple kind of tracking sheet. In the packet that I'll put online, actually, I have several things, stretching tips, nutrition labels, sleep hygiene, all the techniques to do sleep hygiene, and then some cognitive emotional worksheets. That's going to be a lot harder to do on your own, but if, you can read through it and try to do those things. If you find that it's not working out well, you can always, get some help on that too. And then I have the questionnaires too in there. The questionnaires are just like symptom checklists. So in this scales tracking sheet, what I did is put all the months down, and each item you can actually track how you're doing. So for example, if you wanted to track your anxiety level over the course of every month and then practice doing some things, you can track how you're doing. So here's an example of, now you're looking at your sheet. Now what we're going to do is, think about first, why do you want your health? What do you want your health for? Have you ever even thought about that? Why do I care about my health? Think about, some people it might be because I want to make sure that I can perform Hajj, or I want to be there for my grandchildren or great-grandchildren. I want to be able to do more in the community. I want to be able to make a difference in people's lives. So why do you want to take care of yourself? Because then, if you have that down, then you know, okay, what am I going to do? So I would suggest maybe just picking 1, 2 of these topics that you feel that maybe you need some help in. So so let's just say, for example, the easiest one is movement and breath. So basically just exercise. So for example, you would say, inshallah, I will walk briskly for 30 minutes. Oh, that says, or it should say for 3 times per week. So that's where your goal would be. You'd write that there. And then in the first week, if you did it, you just check that off. Next week you did it 3 times in that week, check that off. And then maybe you didn't do it, you just did it twice in the following week, and maybe you did it that week. Once you do all 4, then you revise the goal and say, okay, I'm ready to do something more. Or if you're not able to achieve it, maybe cut it back and say, okay, I'm going to go do brisk walking once a week. Once you do all 4, then you increase it back up. So inshallah, you'll be working towards improving this area one way or another. The best way to change behavior, change practice is to measure it and to monitor it. Let me show you the packet a little bit here, and then we can wrap up. So let me see, view. Okay. Okay, anyways. So here would be like the personal scales tracking sheet. And then, I have the stretching tips here and the online resources. Here are the sleep hygiene things. And here are some of the techniques that you would use to address some of the rational strategies. Oh, really? Oops. Okay. So let's maybe close. Okay. Is it now? Still up there? It's changed. It's changed now? Okay. So I was just seeing if anyone's still paying attention. You are. So, okay. So here's that sheet, and then this is very simple. Some people might have pain as a major issue, and they want to try to improve that over the course of the next year. Some of the stretching tips, and you can read through these in more detail. And maybe that's your goal. Maybe you just want to say, I want to stretch more often, or here are the sleep hygiene techniques. And let me go through these real quick. So maintaining a regular routine, avoiding naps if it's unnecessary. If you're not sleeping, then get out of bed and go and do something else. Don't watch TV or read in bed. Reduce caffeinated drinks. And so other things. Okay, here's some interesting stuff. So here are some of the cognitive distortions a lot of people use. And this is common. This is how the irrational brain thinks. Uses a lot of, I think I covered some of these things already. So should statements, being self-critical. I'll give you an example of like these need statements. Like, my son will say, I need this train. And it's like, wait a minute, let's reframe this. You don't need it. You don't need it to survive. You want it. Or, I need to do X, Y, Z. Well, you don't really need to. You want to. It would be nice. Or people shouldn't be mean. People should not cut off each other. Well, it would be nice if they didn't, but if history has shown you anything, you actually should be expecting people to cut you off because it's happened so many times. So how do you untwist that thinking? Sometimes, you want to identify the distortion. That's one way. Examining the evidence, thinking about the different ways that let me actually just go through these. Thinking in shades of gray, that's something that is very important, so rather than thinking about things in extremes. And sometimes you can ask other people. So, all right. Is there anything else in here? Oh, let me just go through these scales real quick. So for example, here's a scale that's a health questionnaire, and you'll be able to look at, okay, in the last 2 weeks, how much have you been bothered by these things? A little interest in pleasure, depression, sleep problems, energy, appetite, and you can measure them and get your score and put that in there and kind of monitor yourself over time. And if it doesn't seem to be improving, maybe you want to get some help for that. Anxiety inventory. So there's another way of tracking your anxiety. So these are scales that you can use to do that. And it shows you how much anxiety. This is the body mass index chart. You've probably seen that at your doctor's office, where you determine where your body mass is according to your height. And there's, yeah, I'll put it on the website. And this is the K6. This is actually the Kessler 6-item questionnaire, which is used by the by WHO, World Health Organization. So it's used in a lot of different countries. It has multiple translations online. So I have the website there too. So if you want to download it in Arabic or Urdu, you can do so. And this is kind of a nice, quick and dirty assessment of where you are in terms of emotional health. And so that's about it. And I guess I could go back to, let me just give you this last example of that's what my son was doing, building Legos. So yeah, I think, for example, if you say, I want to get healthier this year, that's not a SMART goal. Or I'm going to eat right and exercise from now on, that's not a SMART goal. Something more specific is better. So that's all I had to talk about. Does anyone have any questions? Uh-huh.
Especially in summertime, between Isha and Fajr, there is no way a Muslim who observes prayers on time, can have 8 hours of sleep. So, what are the ways that a person can make up for the loss of the sleep at night? Can he or she make up during the course of the day?
Yes, actually, it says that you shouldn't take naps during the day, but that's if you have trouble falling asleep at night. But actually, if you are depriving yourself of sleep at some other time, you can actually make it up. And taking the naps during the day will actually, help you become more refreshed. And if you aren't getting enough sleep, it doesn't have to be straight out, 8 hours. It takes different times for you to get into different parts of the sleep cycle. Eventually, you go into like delta wave sleep and REM sleep and stuff. But if you don't have enough REM sleep, actually, when you take a nap, you'll actually go right into REM sleep pretty quickly. So the brain will recover pretty quickly in terms of that getting the power naps. Actually, that was a recommendation to be more productive at work, where people realize that, you take a 20-minute nap at work. Obviously you have to gauge it at the right times and stuff, and you can catch up on your sleep. So that's what I would say. Can you say it louder? Sublimation. Explain that again. Is it okay? So sublimation is healthy. It's healthier. So you have a bad day at work. So when you go home, you have a plan to play basketball with your friends, and you play extra hard basketball, and you convert that energy into something productive. That's an example of sublimation. What else did I use as an example? Yeah, essentially converting the emotion into a positive. Yeah, humor is good. Altruism is good. Those are some of the three most healthiest ways of coping. There are a few others too. Here. So, okay, any other questions? So the goal is to become more like this, where you're using your calculated, rational mind to address the other part of the mind.
I mean, your desires is controlled by your mind or by heart?
Okay, so when we say heart, I think there's a good reason why we talk about heart here. There's so many nerves that go to the heart. When the heart is beating fast, it goes straight to the brain and it changes your brain. So there's such a connection between our heart here and our brain. So when we say heart, we're talking about like the part of the brain that is really less within our control, more automatic, more the base drives that we have. Yeah, so we can get more in control of those things through becoming more in tune with our thinking and our autonomic nervous system. For example, when you take your pulse or take your breath and you're following that, you can actually change those types of things. But I don't know if I actually answered your question.
Yeah, actually in Quran it's referred like qalbi salim or qalbi maleen or something. That's really like when you have qalbi salim, like it's I don't know. It's
A calm.
Yeah, calm or it's like
Yeah.
like worldly or something. I don't know. It's tranquilated. I guess.
Yes.
Control your mind as well.
Yeah, I mean, when we think about that is part of that emotional part of the brain, and that is very in touch with the heart, and that's what we're looking for is that calmness in that part of the brain and body. And again, that's why it's mind body, because it is so connected to our physical. So.
I wanted to follow up on
Yeah.
what Nassim asked. In the Quran, generally, the heart has been used as something that thinks, that reflects, that sees, that feels. Even the place of the intention, the niyat is heart.
Mm-hmm.
So the Quran does not necessarily describe the heart as a blood pump that is pumping the blood.
Right.
How does the medical science look at the heart?
Uh-huh.
The Prophet ﷺ said, "Ya muqallibul qulub,"
Mm.
"Oh, the turner over of the heart, thabbit qulubana ala dinik." Keep my heart firm on the deen.
Mm-hmm.
So this is what Allah is describing subhanahu wa ta'ala in the Quran.
Yeah.
And how does the medical science look at it?
Go ahead. Yeah, you want?
أفلم يسيروا that's in Surah Al-Hajj أفلم يسيروا في الأرض فتكون لهم قلوب يعقلون بها قلوب that will think يعقلون من العقل عقل is the mind
Right.
then Allah Allah subhanahu wa ta'ala, he uses the word يعقلون for the heart. أفلم يسيروا في الأرض فتكون لهم قلوب heart يعقلون بها. Subhanallah.
So aql is not just the mind, but more of the logical, cognitive mind, correct? It's more of like the rational brain versus the heart is more the emotional part. So so if you look at an intention, all those things, when you look at the anatomy and physiology, there's so much connection. So when you think of, okay, with the brain, okay, the brain's up here, but you also have the spinal cord and all of the connections that are going out. You also have the cranial nerves. That's different than from the spinal cord. So there are cranial nerves directly from the brain going to the heart, the vagus nerve. So you're getting, there's such a significant connection between the brain and the heart that, you can change your emotional state by changing your rate of your heart rate. So when we talk about the heart, I think that's another way of looking at it, that, metaphorically. But, right. I used to think the brain was the most, this is a joke, where you say, I used to think the brain was the most important organ of all organs in the body. But then I thought, look what's telling me that.
And then in another word, Allah subhanahu wa ta'ala used in another ayah, أَمْ لَهُمْ قُلُوبٌ لَا يَفْقَهُونَ بِهَا. يَفْقَهُونَ. The other ayah was يَعْقِلُونَ. So thinking, basically, Allah used it for the heart.
Yeah, but also like
And I heard that scientists have discovered recently that the heart is thinking. It's not only pumping.
There's a mind too.
But in
Mind.
Quran also, like there is a different word for the heart. When it's referred to, it says afida. Afida is like a physical heart, like pumping, throwing the blood. But when it says the qulub, that's what you're saying, connection with the
Yeah,
that's
right.
rational thinking.
It's a metaphor.
When you say yaqulun or yafqahun, it's always referred to qalb. It's never say afida. But when Allah is referred, like when we gave you eyesight, like basara and sama, and then it's used afida. So that's a physical heart.
Right. That's a very good point. That's how I've always thought of it. That it's more of the metaphorical heart as opposed to the physical heart.
Like spiritual or something is referred to qalb,
Yeah. Right.
thinking, and then when it's like a physical, real physical, so Allah use the afida, it's not use qalb like that.
Yeah. That's how I think about it too. So,
People
but,
used to say that I love you from all of my heart.
yeah.
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 But our instructor in the school was telling us, no, I love you from all of my hypothalamus.
Oh yeah. No. Well, no, there's a you. Yeah.
Nowadays, it's
Yeah.
going